Okay, we are good to go. So I'll just quickly share the screen and just have the video being played.
It's already late. Where's Arjun?
He's looking for universities, right? Maybe he's held up there.
You look so tense. By the way, did you get to choose the university?
No, I'm unable to find a university that meets my requirements.
Whoa. Meet your requirements? What exactly are you looking for?
I'm looking for a place that gives me an opportunity to grow, to excel, to invent, and to innovate. I want to be a part of an institution that paves my way to discover myself and to witness the world moving forward in technology. I want to go to a place that sets a futuristic pattern of education filled with ideas and radical performances. Basically, I want to live my dream.
Sagar University. Live the dream.
Good morning, all of you. Good morning to all the students from Pan India who have taken the effort of registering for this particular webinar. And a warm welcome to all the speakers. We are talking about, today we are going to talk about the careers in nursing sciences and the way forward. I think last 1 year, there's been a lot of talk about increase in the healthcare activity, more and more people are required. I think the entire system of the healthcare was exposed, and we are currently seeing in the last 1 year, we are also currently going through it, the way the entire country is facing severe shortage of healthcare professionals. So it is the right time. A lot of students who are thinking about what exactly happens in this is a good opportunity for all of you to meet our senior academicians as well as people from the healthcare industry and interact with them today to find out how the specialized programs in nursing sciences can help them get a good career. Not only a career, but while during the program in terms of internships, job opportunities, and job roles. In fact, there is a good saying, tomorrow belongs to those who prepare for it today. So Dayanand Sagar University, Bangalore, in association with its partner CD Cymer, Dr. Chandrama Dayanand Sagar Institute of Medical Education and Research, as well as in partnership with Sagar Hospitals, today brings out this particular webinar for all aspiring students from the second PU or the 12th science stream for a great career in the healthcare industry, careers in nursing and the way forward. Before we move on and to the speakers, let me take the opportunity of welcoming all the speakers for today. Our first speaker for the day is our Honorable Vice Chancellor, Dr. K.N.B. Murthy. Sir is a professor for computer science engineering and the Vice Chancellor at Dayanand Sagar University. Sir has been the former Vice Chancellor at PES University, Bangalore. Sir holds a degree in electrical power engineering, master's degree in electrical engineering from Indian Institute of Science, and PhD in computer science and engineering from IIT Madras. Sir has worked as a research specialist in parallel computing at New Mexico State University, US. Sir is currently a member of Karnataka State Higher Education Council, also the chairman for Board of IT Education Standards called as BITES, the chairman of Rangnath Center for Information Studies called RCIS, and also the academic senate member of IIT Dharwad. A warm welcome to you, sir.
Thank you, Shinde. Thank you.
Our second speaker for the day would be Dr. Pushpa Sarkar. She is the Dean for School of Allied Health Sciences as well as Basic Sciences, former Dean and Director at Government Medical College Mandya, Director at Rajiv Gandhi University of Health Sciences, former Director at Rajiv Gandhi University of Health Sciences, with a total of 32 years of experience in the healthcare field. A warm welcome to you, ma'am. Our next speaker for the day would be Dr. Sharmila Jay. She is the principal of School of Nursing at Dayanand Sagar University. She's done her BSc Nursing, MSc Nursing, and PhD in Psychiatric Nursing. Additionally, she has done the PG Diploma in Guidance and Counseling, Cognitive Behavior Therapy, and Alternative System of Medicine. Having over 20 plus years of experience, she's previously held principal positions with Padma Shri Group of Institutions as well as Omayalachi College of Nursing, Chennai. A warm welcome to you, madam.
Thank you, sir.
Our next speaker, speaker number 4 for the day, is from the healthcare industry. We would like to welcome Mrs. Lata R. Nonis. She is working as the Chief Nursing Officer in Fortis Hospital, Bangalore, and have 30 plus years of experience in the nursing field. Started to work as a staff nurse and grown as a Chief Nursing Officer. She has completed her GNM from Mangalore and her PCBSc from Bangalore. She's done her MBA in Healthcare Management from Sikkim Manipal University and completed Nursing Leadership Program from Harvard University. She has worked in various hospitals like Unity Health Complex in Mangalore, Ramakrishna Hospital in Bangalore, and later moved to Wockhardt Hospitals and from there to Fortis. She has worn many hats as Code Blue and Crash Cart Champion, IPSG Champion, and JCI accreditation. She has been part of the QIP and Lean projects in the hospitals, won many Value Champion awards, which inclusive of Nightingale Award of Fortis and award for the best approachable leader. It's a pleasure to have you as one of the speakers, ma'am, and a warm welcome to you.
Thank you so much.
And it's always good to have our alumni, students who have passed out of DSU, to come and share their valuable experience, both in terms of the academic experience at DSU, as well as the experience that they are getting or the benefits because of the good learning that they have done at the current job. We take the opportunity of welcoming our next speaker for the day, Ms. Subida Newpain. She is a graduate from DSU. In fact, she has been a student from the first batch of the nursing college at DSU. She's currently working at neonatal intensive care unit, which is a part of Nepal Medicity Hospital at Nepal. She joins us today from Nepal. A very warm welcome to you, ma'am.
Thank you so much, sir.
I now would like to request the Honorable Vice Chancellor, Dr. K.N.B. Murthy, to set the context and share his views and the guidance to students on the careers in nursing sciences. Over to you, sir.
Thank you, Shinde. Respected panel members, warm welcome to all of you. I'm extremely happy as the Vice Chancellor of Dayanand Sagar University that the admission department has organized a series of webinars, which are nothing but the virtual campus info sessions to bring awareness among the aspirants about the various programs that are offered, also the career opportunities in each of these programs. Today, this campus info session is about careers in nursing and the way forward. Congratulations to Ms. Shinde and his team for doing a wonderful job in the recent months. Let me begin by telling all of you that we are in the middle of COVID pandemic. I think it started somewhere around December 2019, still going on. All the countries in the world are affected, and everybody is trying their best to come out of the difficult situation. 2-3 things have happened in the process. The first, the entire world has started realizing that the healthcare sector or the governments have not prepared for this kind of a situation. However, they're doing their best to handle the situation, control the entire thing to the extent possible. Second lesson that was learned is that the amount of knowledge, amount of skills that the people have acquired in the past are inadequate. Therefore, something more to be done in the future. There's a lesson to be learned. The third good news that we also have is the pandemic is more or less coming to an end. Maybe it may continue for another 6 months to 1 year. By the time the entire world will be prepared to handle the situation. There's a good news that we have. Whatever be the situation that we are in, I think the life should go on. And it's also necessary for us to plan our career paths to move forward. I'm sure each one of us are doing our best to handle the situation in our own way. And I'm extremely happy that the world is trying to come back to normalcy, and over a period of next 1 or 2 months, I think the situations will be slightly better than what it is today. Meaning the examinations would happen, the board exams would happen, the entrance exams would happen, the academic activities would start in the month of September, October kind of a time frame. Having said that, we need to look at what exactly is going to happen in the future. It's necessary for us to what the future is going to be. I'm going to talk about few things in general, then talk about nursing in particular. And there are several world proactive organizations like the World Economic Forum, the World Business Council for Sustainable Development, the Harvard Business Review, MIT Technology Review. All these organizations have started predicting how the future of work is going to be. what is going to be present, what's going to be not present. They have clearly made some predictions. First prediction they made is that there'll be complex disruption in the years to come. In the sense, a lot of changes are going to happen. That's one prediction that's been made. Second prediction that's been made is the rapid technology evolution, whereby technology is going to be part of every aspect of life going forward. That's this second prediction they have made. The third prediction they have made is that the workforce environment or the workforce expectations are going to be different. It means the people who are going to work in an organization, they start putting some conditions for working. Means the flexibility of working and things are time. That's the other thing which is going to happen. Then there will be always socio-economic changes that are going to happen. There's a fourth change that's going to happen. That's what we predicted. The next prediction that's also been made is that going forward in the next 5 to 10 years, the existing jobs, what are the jobs that we see today, may slightly change, and some of them may completely vanish. That's the other prediction we made. In the sense, the technology is going to take up the role in a much bigger way than what it used to be. Therefore, the artificial intelligence, the machine learning, the 3D printing, augmented reality, virtual reality, mixed reality are going to occupy in a very aspect. And there's also been predicted there'll be lots of jobs available in the future. There'll be lots of jobs created, not in the present form. There's a different form altogether. There are a lot of technology-enabled sectors like the food technology or agricultural technology. There's one thing that's going to change. Healthcare is another prominent thing which is going to change in a big way. Then the connectivity, the computing power, finance, the faster construction technologies, everywhere there's a technology is going to be used. This is the kind of thing that we see in general. Jobs are going to be plenty. But jobs require a different kind of skill sets than what we have today. Therefore, we need to prepare for those kinds of things. Education institutions, the progressive ones like Dayanand Sagar University, have to take up the challenge and how to educate the students in the new age technologies to face the future. Coming to the nursing, as all of you are aware, nursing is basically curing. That's the area in which a lot of work is going to happen. This is going to be the most sought after program because this nursing course will be more challenging. There'll be a lot of hard work. It's going to be popular. I'm sure it's the most respectful profession going forward. The broad areas of present day nursing of the nurses is that take care of the sick people, dispense the medicines, keep the patient records, operate the medical equipments. These are the kinds of roles that are being played. Going forward, is predicted that nurses may have to play a larger role with the help of technology. There will be a lot of technology is going to be in the healthcare sector. I'm sure there will be three different stages. So the first one is the preventive healthcare, where technology would make early diagnosis. Thereby, the prevention is one area where a lot of things are going to be done. The second one is once the diagnosis is done, how do we take care of the health conditions? The third is the post-diagnosis after the disease. How do we maintain the condition of the patient going forward after the entire thing is cured? How do we take care of it? That's the third part of it. I'm sure technology is going to get into each one of them. Therefore, the future nursing courses have to involve the technology-based training. I'm sure Dayanand Sagar University would do all of that going forward. 2 or 3 predictions are also there as far as this nursing is concerned. One, at this point of time, India has zero point 0.7 doctors against 1 for every 1,000, which is globally defined one. Globally defined is 1 for every 1,000, but right now India has 0.7 doctors. As for nurses are concerned, at present we have 1.7 nurses for every 1,000 people, but the global standards is 2.5 nurses required for every 1,000. Then the number of beds, it's 0.98 for every 1,000 people. It appears the global standard is 3.5 beds per 1,000. That's the standard. More or less in each of these kind of things, India is falling behind a little bit. It also been predicted that at this point of time, roughly about 2.1 million nurses are there, approximately, registered nurses, which is nothing but 21 lakhs. In the next 5 to 10 years, 5 years has been predicted as about 2.4 million nurses are required, or 24 lakh nurses will be required going forward. The other prediction that's also been made is by 2030, 60 lakh nurses will be required to take care of the healthcare sector, meaning nursing courses will have tremendous job opportunities. And the other thing that's also being predicted is that apart from what the nurses are doing today, in the future, nurses may have to do the analysis. Before the doctor attends to a patient, nurses would look at the patient, do the early diagnosis with the help of technology, make some of the references, some of the notes for a doctor to take it forward. I think the role of a nurse in the future will be much more challenging, much more technology driven. And it's also been mentioned that according to the Bureau of Labor Statistics of the US, it's been indicated, predicted that there'll be 12% growth in the nursing sector going forward in the next 10 to 15 years. Overall, this particular program study will have a lot more technology, and I'm sure they're going to do a lot more service to the humankind. I'm sure they're going to contribute for the overall health of the globe. And I'm extremely happy that Dayanand Sagar University is organizing a webinar and also has invited eminent speakers to talk about the topic. And one thing that I would like to mention, then close my opening remarks. At Dayanand Sagar University, the nursing courses will have a kind of experiential learning. In the sense, we have Sagar hospitals and we also have a medical school called Chandrama Dayanand Sagar Institute of Medical Education and Research, CD Simon. CD Simon Hospital is also there. Therefore, the training would be given in both the places. Thereby, the experiential learning gives a lot more hands-on experience. Therefore, the nurses who will go to graduate from the DSC system will be much more accomplished and they'll be most sought after in the market going forward. I thank the organizers for giving me this opportunity and also thank all of you for a patient hearing and thank all of you for taking time off your busy schedule to be with us this morning to attend this the campus info session. Thank you. Thank you very much.
Thank you so much, sir. It's always a pleasure to listen to your advice. I'm sure the students will be benefited by knowing more about the activities and the program details under the healthcare industry. Thank you so much. We now take the opportunity of inviting our Dean, Dr. Pushpa Sarkar. Over to you, ma'am. Ma'am will be talking about overall healthcare industry and requirements as of today.
Thank you, Mr. Sundar. Honorable Vice Chancellor, Professor Sharmila, Mrs. Lata, Ms. Subeda, and the CMO, Mr. Shinde, and all the other participants, dear students. Very good morning to all of you. Now, everyone is knowing the havoc created by this COVID-19 pandemic. And so all eyes across the world is towards the healthcare industry. Now, every attention, everywhere, even the villages, everywhere, the attention is shifted to healthcare industry. Even otherwise, other than this pandemic also, otherwise also, this healthcare industry has been a huge economic drive in the recent years with such technology and evolution. It has been gaining a lot of importance and moving ahead in a fast pace. Now, the need for the medical treatment and disease prevention is growing. Now, coming to India, globally, in fact, as estimated by WHO, by the year 2030, it is projected to create around 40 million health sector jobs. That's translates around 4 crores jobs coming up across the world. Now, in the Indian scenario, healthcare has become one of the India's largest sector, both in terms of revenue and also employment. The Indian healthcare sector is growing at a very brisk pace, and presently it's worth a lot. Now, I would want to mention here that Indian healthcare industry is the second largest service provider, second largest service sector provider in the country. It provides jobs for around 40 lakh people, 40 to 45 lakhs people every year. Now, India today faces an acute shortage of skilled manpower, which makes it unable to meet the health needs of the population. There are job opportunities, but the skilled manpower is in very much dearth of the skilled manpower. So, what do we say? Anyone, if at all you see many sectors, many companies, many industries and multinational. You hear that whenever there's a pandemic, whenever there's any natural disaster, or when the economy slows down, there are layoffs. You understand? The students they lose their jobs. That's what I mean. But if at all you see, you're looking for a job security in the coming years, there's no other place. There's nothing to look further than the medical field, in this healthcare field, I mean to say. I don't think you look anyone in the healthcare sector who is graduated and are there without any jobs, because the need is so high. Now, among the jobs, when I'm coming to jobs across the healthcare sector, you have doctors, you have nurses, you have public health officers, you have allied healthcare amounting to more than 100 courses, so many of them, right? But among them, the highest demand is for nurses across the globe. Yeah. So it's a very high demand. In fact, many countries like UK, US, Australia, they ask help from India to provide the skilled nurses over there. Now, nursing, if you say, when we concentrate on the nursing, it has been the oldest of the arts. The term nurse is evolved from the Latin word that means to nourish. Now, nursing has emerged into like earlier nurses, that's it. Now it has emerged into an identifiable, separate, learned discipline. Now you call it as nursing sciences. We just don't call it as nursing, we call it as nursing sciences, that is both art and science. Now you see that the era of increased globalization, emerging infectious diseases are the problem across the globe. Hence, increased healthcare necessities and also increased need of the healthcare workers. Now, the current outbreak of this COVID-19 is declared as a global health emergency and has placed enormous strain on the global healthcare sector, workforces, infrastructure, supply chain, everything. And the nurses are the prime here. Lord, very much like shortage is too high. Of course, there's a dismal proportions of doctors to patient ratio, but nurses also are very much in dearth. Now we say that nursing profession, it's the backbone of the healthcare system. You walk into a hospital, a small setup. When you go to a hospital, many of you, the students might have visited a hospital. What do you see there? You see more number of doctors, or you see more number of nurses. When you enter a ward, you never fail to see a nurse, right? You see nurses everywhere around in the hospital. So that shows that it's a backbone of the healthcare system. They contribute to healthcare within a multidisciplinary team, including doctors, nurses, and other healthcare workers. Now, you know that nursing workforce is critical in the global health. They're essential to achieve this universal health coverage. Now, that is across the globe. Now, this is what even WHO is concentrating on, this universal health coverage. There are particular guidelines, particular where they want to achieve this. They're concentrating on this universal health coverage. Now, as this pandemic is sweeping the globe, you see that these nurses are the frontliners who respond immediately. So, WHO also has highlighted the importance of nurses who have been at the forefront in fighting this pandemic. Now, this pandemic is also a stark reminder of the vital role played by the nurses. They do not go home for hours, days together. They're in so much of service. Now, you know that even in India, you see, there are a lot of nurses. We produce many nurses. Across India, we have many nursing colleges. Now, nurses amount for more than half of the worldwide health workers. But even then, there's a dire shortage of nurses worldwide, not only in India, but across the world. It's estimated that the world needs more than 9 million nurses to achieve this universal health coverage, what I was mentioning, by 2030, in 5 to 10 years. Now, universally, you say, what are nurses? When you see nurses, you say, who are these people? So what thing you come to mind is, these are selfless individuals. They take care of every patient on the personal level, and they have one-to-one relationship with the patients. Now you see so many patients, every doctor cannot be there for every bed or every ward. So you see these patients lying in the hospital bed, just waiting for a personal touch, which only the nurses can provide, because they're always there with the patient. They assist both, not only physically, but also psychologically. Now the care, the compassion, the kindness, commitment, they make them to stand them out. Now, but this is not enough. What is required is optimism and competence. Now, the features of these nurses should make a difference, creating a difference to the individuals, to families, thereby to communities, and to the country and worldwide, everywhere. So there should be a significant impact by these nurses. Now, but what I would like to say is, now whatever has been the nursing, the routine, nurses, what you see or what you think of, is the role is constantly changing. Now new modules of care have been explored, and nurses are at the center of our health systems. Now modern nurses, it is not only enough to follow the instructions of the doctors. They need to use assessment skill, knowledge, having the ability to reason out. Now, what's happening when the patient walks in? There may not be a doctor to attend, so many of them. So when the patient is brought into emergency department, now they should have the knowledge and also the ability to reason out, okay, and make judgment depending on the patient's condition. Now, there are other speakers who want to go into detail of the role of nurses, but coming to the scope of the nursing practice, because today we are seeing of the career in the nursing profession, there are so many. The list is endless. You can be employed, hospitals, nursing homes. You can be in the clinics, in the health department. You see them in the orphanages, old age homes, in the military. It may be Army, Navy, Air Force, Marines. Then you see them in the community settings, in the industries, factories, railways, public sectors. Okay? You can even see them in the training institutes as educators. They can go for home care, palliative care. So they can give individual nursing care to the patients, geriatric patients or patients at home. You can be employed in the public health agencies, then ambulatory care centers, then everywhere, the corporations, occupational settings, mental health services, de-addiction, you have centers for de-addiction where there also you can be served there. And you can also be a researcher promoting advances in the healthcare and health promotion also. So nurse educator I was mentioning. So nursing managers, you can be employed in the policy making of the government. They can also employ you as a member of these policy making in the healthcare sector. So you can see that they can, so much of diversity, different areas of the nursing practice. This is the general nursing, where you are expert in most of the things. Now, if you really want to concentrate on a particular thing, where you want to specialize, where you can take up into critical care, then emergency department, women's and health, mental health, sports injury nursing. These are all new things which is emerging. You have nurses trained only in cancer care nursing, cancer nursing, cardiac care nursing, newborn intensive care nursing. So many of specialties are there where you can really want to specialize and concentrate, and the need is so high. Now, we know that India has also been the world's largest source for this nurses, trained nurses. As I told you, in US, UK, Canada, Australia, we have so many of Indian nurses, skilled workers who are working there. So now if you see there's such diversity, what I was mentioning, the list is endless. There are many, many more. Now, if you see this diversity, there's so much of scope. Now to achieve, now the scope is there, fine. Now what do you want to need? What do you need to be employed in these areas? So to achieve the competence and the skill to enter into these various job opportunities you need to have excellent training and also exposure to various procedures and various diseases and so on and so forth. Now such training can be provided only in a medical college and teaching hospital. Here is the only where you can see the diversity of all the departments. So you are exposed to all 21 departments, any specialty, all departments. That is the exposure you get in a medical college. Now, at the Chandrama Dayanand Sagar Institute of Medical Education and Research, to simply say that Chandrama Dayanand Sagar Medical College, you are very fortunate to be trained under the same teachers who train the doctors. Now you'll be sharing the platform along with the medical students here. Moreover, you have all the modern equipment, world-class facilities, and the patient input also is it's a plus point for you, where the patients are from various socio-economic strata. If you go to these multi-specialty hospitals, you see only the cream there. Whereas here, you see from across all, from the very poor patients to the rich patients, you see every type of patients and all types of diseases because you have all departments here. So you're exposed to various conditions, various diseases, their management, everything. And you'll be trained and have the opportunity to work in a multidisciplinary team here. I mean to say, you are working along with the doctors, along with the senior nurses, along with other healthcare workers like public health officers, and along with all the technicians, specialists and other healthcare services. You're working with them. So you have an overall development, how to go about a particular case. It is not only the nursing point of view, from all point of view, as a whole, a particular condition or a disease, you can know how to go about with a patient. This is one. Now, by undergoing this training, you will emerge as a very highly confident graduate who can take up any challenge. Okay, you go confidently, and I was mentioning so many areas where you have your, who will welcome you with open arms when you're a skilled worker. So there's a tag here where it's displayed saying that tomorrow belongs to those who prepare for today. Now, there's also a saying that a task well planned is half done. That's why, students, I'm also telling you how you plan, to what course you want to do. You're all science students. In your PU also, you're learning so much of biology there, PCB, and you will be interested in the human body and how it performs. So it is better to plan, you have to have an idea of how to go about. So you plan for tomorrow. So definitely to what course you're getting in, and nursing is one of the best course for you to enter into. Looking also one for service of the mankind, and the second thing is the various job opportunities you have. So I wish you all the best, dear students, all the very best to all of you. And thank you, Mr. Shinde, for providing this opportunity to make a small talk over here. We have the other experts who will throw more light into the details of the nursing profession. Thank you.
Thank you so much, ma'am. It was nice for all the students to hear from the mouth of the dean, to see how the industry is going to progress, how the healthcare industry today is in dire straits and requirement of a lot of healthcare professionals, and definitely nursing being one of the primest requirements today for the healthcare industry. So thank you so much. We would now like to invite the principal of the College of Nursing at Dayanand Sagar University, Dr. Sharmila, and she will be talking about the programs offered, outcomes, the benefits that the students can seek, as well as she'll also throw lights on the internship opportunities being offered at our partner institutions. Over to you, Dr. Sharmila.
Thank you, Shinde sir. Sir, can you kindly permit me to share the screen?
Yeah, it's already been given to you.
So able to see my screen?
Yes, ma'am.
So happy morning to all of you. I would like to take this opportunity once again. I would like to join with Mr. Shinde in welcoming you all for this virtual webinar on career opportunities, to all the dignitaries and also to all the participants. And I would like to thank our Vice Chancellor, sir, for giving us an overview about our nursing profession. And also a special thanks to our Dean Madam, Dr. Pushpa Sarkar, for highlighting on the statistics and also the different specialties, which Madam has clearly very in detail explained about all the specialties and the need for nurses internationally and also the globally. So thank you, Madam, for that. And as well as we all know that in the present scenario, nurses are the one who are throughout with the patients in the hospital at this pandemic situation too. And also, as you all know, that nurses are the backbone of the healthcare system. And there is a very high demand for the nurses nationally and internationally. So this global demand for the nurses increasing, as our madam said about the statistics about the job opportunities, also madam has explained about the job opportunities at nationally and internationally. So we are happy as Dayanand Sagar University, we are happy to inform you that as College of Nursing is providing the programs such as BSc Nursing, PBBSc Nursing, and MSc Nursing. This BSc Nursing is a 4 years program, and PBBSc Nursing is who have completed their diploma in nursing or who wanted to pursue their degree will be able to do their PBBSc nursing. And the gateway to do PBBSc nursing is after completing their diploma in nursing, need to have 1 year of experience, and followed by that they can pursue this PBBSc nursing, that is post basic BSc nursing. And MSc nursing is masters in nursing with 5 branches or specialized in medical surgical nursing, community health nursing, pediatric nursing, obstetrics and gynecological nursing, and psychiatric nursing. And this is very specialized program. What we offer at Dayanand Sagar University is, as Madam and Sir, our Honorable Vice Chancellors are also explaining about that, we have CD SIMA, that is Dr. Chandrama Dayanand Sagar Institute of Medical Education and Research with 600 bedded hospital, and where we are going to shortly move to our campus, and means that we have hands-on skill right away, and where the students will be able to take their practice and skills will be provided. And also at Sagar hospitals at Tilak Nagar and JP Nagar. So they will be having 6 months of clinical training at the end, and also they also can be observed as a staff nurse, and where they'll be able to take up as nursing officers job, and also they can grow in their hierarchy. What is the outcome next? What is the outcome of these programs are? Preparing the finest professional nurses who care, cure, and create new knowledge in improving the health of the individuals, families, and communities. As I have mentioned, we provide hands-on skill at different specialties like medical surgical nursing and the pediatric community health nursing. We have a very good community facilities, and our graduates will enter the healthcare field with a solid foundation in theory, clinical skills, research, and hands-on community services, where they'll be able to practice independently, and also they'll be able to meet the demands globally, and they will be able to compete to work at the international, national, and international levels. We assure you that we prepare and provide the standards of nursing in par with international standards, where they'll be able to compete with international expectations, and they'll be able to work there, and also set them apart as leaders in their profession who are qualified to bring change in the face of healthcare delivery system, which means that they'll be able to be as prepared to be a part of leader, and also they will be involved in policy making and also in the administrative skills once they are completing their course. Next is the benefits. To talk about the benefits of the course, as I keep on mentioning about, we have, that is the great privilege that at Dayanand Sagar University is, we have our own medical college and hospital attached, where there is adequate facilities with the lab. Hands-on skill will be provided, that is evidence-based practice, evidence-based approach to nursing practice. Graduates will be prepared to provide the highest quality and most efficient patient care possible, and also a real practice approach, where since we are in the same campus, once the patient will be taken on their theory, and also will be done a practical session where they'll be able to go to the hospital, and also we have a very good infra standards of labs with all the equipments, where they'll be able to take their lab and also acquire their skills, hands-on skills. And then achieving the highest learning and clinical outcomes with all these skills with international standards, and gaining a competitive edge in the job market. So I assure that our students will be able to lead and also take up different levels, different positions nationally and internationally, and also will be able to meet in par with international standards and work with international standards. So with this, and I think Madam has clearly explained about what are the different specializations in different aspects once you finish, and you can go be specialist at different levels. And we have our speakers with us, and mainly with Dr. Madam Lata, who is here, who is specialist in the nursing skill, and also she's the chief nursing officer, who will be explaining about the different roles and skills and what she's exactly practicing at the hospital level. I think Madam will be the better person to explain us. With this, I take this opportunity in thanking Mr. Shinde for giving us, organizing this wonderful webinar, and also their team. Thank you, sir.
Thank you so much, ma'am. Could you stop the screen sharing?
Yes, sir. Yes.
Thank you so much. We now move to the next speaker for the day. I'd like to invite Mrs. Lata R. Nonis. It's always good to have an industry perspective for both, one in terms of how the program is, two, how it helps the students, and three, how they can use the knowledge that is being delivered by one of the best universities today in their jobs. Over to you, Ms. Lata.
Thank you, Mr. Shinde.
You want to do a screen sharing?
No, I do not have.
Sure, sure.
Thank you. So very good morning to all. And very good morning to Honorable Vice Chancellor for giving me this opportunity. I am Lata Nonis, CNO Fortis Hospital, Bangalore, Banagata. Personally, I welcome all the participants for this session. At the same time, I take this opportunity to thank the organizers of the Anand Sagar University, and special thanks to Ma'am Professor Sharmila, Principal College of Nursing, and Mr. Shinde, and also the organizers for inviting me to share my thoughts. Yes, as we all have discussed, today our nurses are in the world of confusion. So it is our responsibility as nurse leaders to build and bring them up to the expected level of skill and knowledge. In today's world, nurses must deal with broad range of issues related to the condition of each patient, as already Dr. Pushpa Sarkar told about this, which including of complications, improvements, and as well as annotation to the clinical record and communication with physician. So there is a huge responsibility with the nurses. Nursing is an integral part of the healthcare services and has the potential to having a wide enduring impact on health outcome for global population. And as all of you know, the nursing is healthcare profession focused on the care of individuals, families, and communities, so they may attain, maintain, or recover optimal health and quality of life from birth to death. So there is a huge responsibility as a nurse. Nursing is not at all an easy profession, but if we love the profession, we are the best in the world. And I'm sure that all of you know that the Florence Nightingale, the lady with the lamp, she laid down the foundation of professional nursing. So now let me touch upon the career path for the nurses. Today, if we look at, it is not only a female kingdom, even the males are also coming forward to take up this profession. So why the males are entered into this? Many have chosen this profession as serving humankind. And many think that this profession has job opportunities and also growth. It is very, very true. And also we should not forget that this gives us an opportunity to work in overseas. Every day today from my organization or all over the hospitals are facing a shortage. Even sir was talking, ma'am was talking, there is a huge shortage. Why there is shortage in India? Because they are getting overseas opportunities. That is the way how I look at the nursing is. So if you really look at this time of COVID, many more people have come to know the opportunities in nursing. And also the respect and love towards the profession have become very, very high. See, till now, most of the time, it was the nursing, it was under the carpet. We were not out, even though we were doing a lot of jobs. But one way the COVID have brought us a lot of value in this profession. I just would like to mention this especially. So all of you sitting over here can think about the profession as
Ma'am, we lost you.
sorry.
Yeah.
Across the entire patient experience, and whenever there is someone in need of care, nurses work tirelessly to identify and protect the need of individual. And there is a huge teamwork which is happening. If you visit any of the organizations or talk to any of the healthcare industry, the nurses are the front-end warriors. And today, every day, it is in the media, in the papers, in the TV about the nurses, how much they are working. They are working like soldiers. So that is the respect what we have got today in our profession. So nursing can be described as both an art and science, a heart and a mind. So why it is called like that? At its heart lies a fundamental respect for human dignity and intuition for patient needs. This supported by the mind in the form of rigorous core learning. Due to the vast range of specialties and complex skills in the nursing profession, each nurse will have specific strength, passion, and expertise. And what is about the nursing image? I just would like to touch upon this. It is very important for nursing profession, the nursing images to be kept upon. So it is the way the profession appears to others, including to the general public. But to all my students and dear ones, we should be passionate and proud about our profession. No one else can bring passion or no one else can love this profession. So if we are passionate about our profession, we will be able to deliver a compassionate care to the needy one. And please do remember that the nurses are the backbone for the healthcare. We should never stop learning. That is what my advice to everyone over here. And keep upgrading yourself on day-to-day basis. And you have to live in today's technological world. Sir was mentioning today we are in the technology. Yes, I'm so sure of that. And we have a lot of sophisticated equipments to handle. And most of the nurses are in the corporate setup or in the specialty areas handling these equipments, and doctors and the patients depend upon the nurses' feedback on this. So there are excellent career opportunity in nursing. There is no doubt about that. Nurses work in large variety of specialties where they work independently and as a part of assessment, even plan of care, and also implement and evaluate the care. That is what you will be learning in the colleges or schools. Nursing duties are manifold and cover a wide range of functions and responsibilities that depends with the level of qualification and working environment. If we really look at it, there is a nice model which has been brought by Patricia Berner, that is novice to expert model, where you will be a novice and you will become advanced beginners, then competent, proficient, and reaching to the goal of expert. Once if you reach up to the expert, you have start thinking about the career growth, because it is in your own hands. You have to strive to be at expert level. This nursing theory proposes that the expert nurses develop skills and understanding of patient care over time through the proper educational background as well as multitude of experiences. That is why I told nursing is not an easy job. We should keep updating ourselves. And once if we deliver the care to the patients, their blessings stay with us throughout the life. And all nurses complete a rigorous program and extensive education study and work directly with the patients, families, communities, using the core value of the nursing process. Ma'am was mentioning some few of the core values like compassion and care, all those things. So various courses are focused on preparing a qualified nurses. Even Dr. Sharmila was mentioning about general nursing, midwifery, BSc nursing, all those courses available. And just recently, Indian government have brought up for us nurse practitioner. So it is not only at the bedside the nurses have a facility, even we have PhD in nursing. You may be seen many of the eminent speakers today are in PhD. Okay, and we have certificate courses in nursing, that is the specialty. So nursing is a great profession and there is a strong demand for nurses today. Career prospects are good and possibilities are plentiful. Nursing can take you anywhere in the world. This is the truth of today. And nurses work in large variety of specialties where they work independently and as a part of assess and plan and implement and evaluating the care along with other departments. That means the doctors, maybe the physiotherapist, or maybe the other consultants. So demand for advanced practice nurses are growing in many areas. Never before has nursing been so exciting. See, when I took up the nursing, we never had a lot of opportunity. We have to be at the bedside. But today, new graduate has variety of job opportunities available. That is, ma'am was speaking about specialities. Like if you are a specialized nurse, you can be not only in the bedside, you can move even into the admin. So some specialities, what I just want you to know, which is available in the hospitals are, if you can be a medical or surgical ICU nurse or a critical nurse, even the OB-GYN nurse, like this, you will be working with the labor room and the specialty in the lactation nurse, pediatric nurse, neonatal, and one of the speaker is working for the neonatal ICU, I guess. And we have specialties in the post-anesthesia nurse, dialysis, endoscopy, transplant, robotic surgeries, oncology, even PICC lines or bone marrow transplants. Other than that, we have developed in our own organization like medication nurse, trauma care nurse, and diabetic educators. Even pain management from the anesthesia team have moved on to the nurses now. Wound care nursing have been a specialty, cath lab, operation room nurses. So all these things are specialties which is available. Now, I'm sure that all of you would have got an idea where I have to be. This is only, I'm talking about the bedside nursing. Now coming to the administration, see today, most of the organizations are with accreditation. That is a mandate, either with JCI or with NABH. So we have something called quality nurse, who does all the audit and requirement of accreditation. It is very, very mandate. And they do the analysis, okay? So it is just moving out 50% from the bedside care to the admin team. Same way, there is one more specialty called nurse educators. So they are the backbone for, it is not only that your education will be finished in the schools or colleges, but nurse educators do the education in the organization, in the hospital setup. And they are the backbone of education and bringing up the skill in the team in the day-to-day basis. And next category is infection control nurses. See, they does all the audit related how to prevention of infection, prevention of and the control of infection. Okay, and it is not only audit, we will do the analysis, come up with many quality improvement project in the organization. So all those things are done by the infection control nurse. And other than this, we have team leads, in charges, and supervisors. So why I'm telling this, there is a huge career growth. If you think that, yes, I have to achieve it. And if you have a goal, then you can achieve these things. So more than that, nowadays, nurses' jobs opportunities are not only limited to the hospitals. This was already spoken by ma'am, Dr. Pushpa ma'am, about that. So they are into all the military, public health or home healthcare services. Even insurance companies are there hiring these nurses. And most of the pharma companies are hired the nurses because they come from the pharma companies as educators, as I was telling just 2 minutes back. So even the people are there, if the company belongs to some equipment, sophisticated equipment, if the training have to be given, it is more than the biomedical engineer. Along with the biomedical engineer, they have been come along with the nurses, to the nurse educators, to the organizations or the hospitals to give training. So there is a career growth even those areas. More than that, nurses have opportunity to function in the hospital committees. See, earlier, the nurses were not getting an opportunity to be a part of the many committees. So there may be unique positions such as working infection control or quality nurse, they get into the hospital committees. Nurses have role in staff development, recruitment, and all type of committed jobs. So the nurse management and leadership skills have ample opportunity for development in the long-term care setting. So even you all should know, the nurses have moved as administrators, auditors, lawyers, IAS officers, COO for the company, CEO of a company, and the organizations. So these all show that if there is a will, there is a way to achieve. So my request to all of you, start striving from today. First, when you are stepping into the nursing career, please start setting your goals to achieve into this. Dream very high. So would like to conclude stating that in simple way, the possibilities are endless, and as a nurse, sky is the limit. Thank you all for patient listening. Thank you so much.
Thank you so much, ma'am. It's a pleasure listening to the industry experience that you are going through, and also it's a good and a noble thought on a Sunday morning to share your experience with the aspiring students who are looking forward to a career in nursing and the way forward. In fact, many of them are not aware what exactly happens, and that's the reason we would like to thank you that being from the industry, being in such a noble profession and one of the busiest professions today, you took out time and you are able to come and give this guidance to the students. Thank you once again so much on behalf of Dan and Sagar University.
Thank you.
I would now like to invite one of our former students who's passed out of the 2019 batch. Always, it's a pleasure to Dayanand Sagar University to have back our students as alumni who have passed out, who are doing good in the industry, and they can always come in and share their experience in terms of both the activities. One, how the experience of theirs has been in the College of Nursing at Dayanand Sagar University, and second, how the experience is being of being a student has and the knowledge has helped them to secure a good job with the within the healthcare industry. So, not taking much time, I'd like to invite Ms. Subida Nupen to come and share the experiences of hers at one at the university, and two, how is she coping with the industry activities. Over to you, ma'am.
Thank you so much, sir. First, Honorable Vice Chancellor, sir, Dr. Pushpa Sarkar, Dr. Sharmila ma'am, Miss Lata, and all the dear participants. Very good morning to you all. And thank you so much for providing me this opportunity to speak here today and share my experience about being a student in Dayanand Sagar University. As I'm the international student as called, because I'm basically from Nepal, I still remember my first experience when I entered the college, seeing the infrastructures. I was pleased with the infrastructures because all the students who come out from the country, they have different imagination and setup of how it would be and where you're going to study. So looking at the infrastructures from outside, I was pleased. And when I entered inside, the first thing that I saw was the welcoming nature, welcoming environment of the college, of the people there, of the teachers and everything. I remember when I was in first year, it was just in the classroom because it was a theory classes for us. All the teachers were providing us the basic knowledge about what the nursing really is and how we should be starting off as a nurse. Then once we went into the clinical sector, it was dream come true, like reality where it hit us. The experience in the college have given me the chance to sharpen my skills in my field as I started it raw. There was a lot of opportunity and I was learning and improving the way of crafting it. And as a time, it was experience where I can never think of it.
Sharmila, we have a request. Subita, we have a request. Could you put on your video, please?
Okay, sure.
Yeah.
Sorry.
Yeah.
Am
Are you
I
good to
am I
go?
visible?
Since I'm
Am I
on the screen sharing, I will not know. But
Yes, sir. Yes, Miss
Sharmila,
Subida.
ma'am.
Yes, Subida. We are able to.
Okay. So as I was saying that I had great experience there because as a nurse, as a student, I was not even a nurse that time. As a student, when I entered into the college, it was raw, and I'm the first student of batch of 2015 where the Dayanand Sagar University has started, and there was lot of advertisement going on in Nepal. I googled it, I searched it, and I saw infrastructure very well. I'm focusing on infrastructure because that is the first thing we international students see when we come from different country. So first I started seeing the infrastructures, then I went into the website of the university, and I saw many interesting facts about the research and then academics and extracurriculum activities. Once I entered the college, it was a very pleasing environment for us because we started raw. And when we entered the classes, the experience that I had with all the teachers was great. They were highly qualified. Obviously, they had experience of everything. We did not had any expectations because I didn't know from where I should start. But the teacher knew that from where they had to take us, where they have to start us, and where they have to take us. So the provision of quality healthcare by the trained professional in what they were doing knew, because nursing is something which deals with the life of the people, life and death of the people. And now I see my college being developed because just now, as everybody said, Sir Mila ma'am and Vice Chancellor Sir, they have started CD Cymer, like Chandrama Dayanand Sagar Institute of Medical Education and Research. I'm so happy for my juniors because now they are getting internship and they are getting more experience, which we also had, but we had in a different hospitals. Like we had in Sagar Hospital, Sri Krishna Sevashram Hospital. We went out from Bangalore to get the mental health experience. So we went to the Harvard Institute of Mental Health and Neurosciences. We went Vani Vilas Hospital. We went to different health sectors to gain all knowledge. And when I work in my hospital, in my home country, I feel privileged to study in Dayanand Sagar because when I compare myself and my colleagues, it's like I know most of the things which they are still learning. And when I was student, when I went for my clinical things, I compared myself with the students who used to come to the same hospital, because when we were doing some work, they used to look at us and they were like, oh, this, you had already done this. And we were like, yes, our teacher had taught us this in our labs. They have already made us familiar with the terminologies. They have already made us familiar with the procedure, and they had already made us able to focus and be strong when we go out in the hospital and do it. And then it was very pleasing for me, and I was very proud because I was the student of Dayanand Sagar, because they have given us lot of experience and quality of learning. As ma'am already said, they really provide us quality education, and they mainly focus on their students and their outcome, because in the Anand Sagar University, not only from India, there are the students who come from international level, and they have the university really have to maintain the quality and maintain that standard, so that when the student grow out, the student can do the the things and the learnings which they have got in university. And in my experience, they have really done the great thing, because now when I come and work here, I work in an ICU, neonatal intensive care unit. So I am really pleased, because we already have seen a lot of cases in Vani Vilas Hospital, and I'm familiar with those cases, and I can easily handle the pressure with, and I can predict what is about to happen, because I have seen that thing in my student life. And also I really want to say to all my juniors that teachers are the one who provide you with everything, because they start with the scrap and then you can build everything. But it all depends on you, how you take it. Because I was also in a student life, and I was like, I used to bunk classes and all. But when you go to the clinical sector, you have to give your heart and soul. It is not teachers who will always be behind you, like, like, I mean, like, sorry, it is the teacher who will always be behind you, that they have to do like, you have to do like this. But as a student, it is you who have to be like very confident and who have to take it upon. Because once you graduate from the university, it all depends on you. Then once you start working, it all depends on you. So as a student, just get all the experience and all the opportunity that this university or the teachers are providing you in classes and in the clinical sector, because it is very much useful and helpful. I, being the first batch of the Anand Sagar University, have experienced a lot of things, and now I see university and college being more and more facilitated with things and technologies. I'm so happy that you people will be so privileged with all the technologies and all the upcoming things. So just be focused and just learn, because they will provide you with all the requirement, all the things that you need, but it is you at the end who have to take it. And it depends on you how you will make yourself presentable in front of others once you graduate. So that's what I want to say. Thank you so much for providing me this opportunity. And I personally always tell to my juniors or my relatives or anybody who always come and ask me what I should be learning or something, then I will say that you should be a nurse, because you deal with the people's life, you deal with the people emotion, you see how a person in bed, you know, survives and how they lose their life. So you are there when the person is born, like is when the person starts their life, and you are there when the person ends their life. So you are the vital person who take cares of the hospital, as ma'am said and all. We are the backbone of everything. Doctor comes, they prescribe things, they will just see the condition, they will see the reports and all. But we are there 24/7 taking care of a patient. We are there knowing their sorrows, their emotion. We are there to do everything that the person needs to be a better, so that's why I am very proud to be a nurse, and I will always be proud to be a nurse. And thank you so much for providing me this opportunity. And I'm so blessed that I am a graduate from the Anand Sagar College of Nursing Sciences. Thank you so much.
Thank you so much, Subhita. It's wonderful to hear you, understand your experience, both in terms of you as a student at the university, then in Sagar University, and now at the job based out of Nepal. with the Nepal Medicity Hospital. Thank you so much for your time. I know it's a tough time to take out a time to come and speak about the opportunity, when on the other side the requirement in the hospital is also where they would want your time to be. So thank you so much for sharing your experience. uh, Moving forward, I would like to inform all the students who are available today for this webinar that the applications are open not only for the BSc nursing but also for the MSc nursing program, and they could visit the website www.dsu.edu.in, and they could go in and fill in their applications, and they could select the courses under the allied health sciences. And if they are very particular about nursing sciences, they could go and select the BSc. And for all students who are who have completed their BSc and would want to go for higher studies, could also look at taking admissions for the MSc nursing programs. So if at all there are any queries, I think it is time that we take up the queries. I would request all the speakers that you already must have been seeing the queries. So can we look at answering some of them? There is one question: to do nursing after second PU, what should we do? Can Sharmila ma'am answer this?
Yes, yes. Sir, could you hear me?
Yes.
Okay. So the question is, after doing the PU, what we should do for entering into BSc nursing is, you should have taken the branch of maths, physics, chemistry, and biology. Physics, chemistry, and biology, and you should have 50% you should have obtained
To opt for
any health sciences. Sir, am I audible?
Yes, ma'am, you're audible.
Hope I have cleared that question.
Yeah. There's another question. Actually, this is the second question coming in from Mehak. I mean, can I take admissions in Masters of Nursing without experience? And sir, when are the admissions open for Masters? How can we apply for admissions right now?
To enter,
Closed.
to enter into Masters in Nursing, the gateway is you should have 1 year of clinical experience, after clinical experience, or in the academic side after completing your BSc Nursing. So definitely you need to have a 1 year of either clinical experience or academic experience.
Suppose if they are not from that particular field, because I think this is what she is trying to mean.
Not in the field in the sense like.
Let me answer this, Mr. Srinath.
Not.
Yeah.
If while doing the MSc nursing, they have to have a BSc nursing degree or maybe BSc nursing degree. Otherwise, with any other degree, like other BA, BSc, they are not eligible to take up MSc nursing. In fact, that's because rules are governed by Indian Nursing Council, INC, or Nursing Council of India, what we call. So they have laid down all the rules, and the students can also visit the INC website, Indian Nursing Council website, and they can see all the other regulations also, detailed regulations. But here also they can ask any doubts they have here, and plus they can also visit the website.
Sure. I don't see any more questions on this. There's a question on BSc Agriculture. Right now, we do not have a BSc Agriculture program. So I think that's it right now in terms of the questions being asked. If there are any more questions, we will separately answer it for all the participants. You can always visit our website and get the details, and you can also email us you must have got the invitation from the same email ID or from the same mobile number. You could get back to the respective people, and we will always be happy to answer your questions. So thank you so much to all these aspiring students, and a big thanks to all the speakers today for their time. And I'm sure this is going to help the students a lot, especially when the board exams are not announced and the students are in the process of waiting. It is always good to go with such career opportunity programs and understand what is it that you as a student can take up post the examinations are over. Universities like Dayanand Sagar University have already started the admission processes. One, because the number of seats are less. Two, there are already students available who know what is it they are going to get from any of the exams that take place. They are sure about what percentages they will be getting. There's always a range of percentage that they have in mind because they have already studied thoroughly for this particular board exam. So for such students, we would like to invite them for a direct admission process for any of the programs under the Allied Health Science, including programs under the BSc Nursing Sciences. So thank you so much, and we look forward to seeing you soon.